Next, we're going to perform the inspection and examination of the abdomen. Jason, can I examine your abdomen?
Sure.
All right. The first thing that we do, like the other examinations, is perform a visual inspection. Of course, looking for any defects, looking for any distension of the abdomen, old scars, any kind of lesions whatsoever, pulsations in the epigastric area. We also generally like to assess for any kind of ventral or umbilical hernias. We can do this by having the patient cough. Jason, could you give me 3 quick, strong coughs? Good. Now, could you lift your head off the bed also? Good. Sometimes these cough maneuvers and lifting of the head can bring out a ventral or umbilical hernia. All right, the next thing that we like to do is part of the abdominal exam involves auscultation of the abdomen. Jason, can I listen to your abdomen?
Sure.
Okay. The reason why we auscultate before palpation is because deep palpation of the abdomen can alter any kind of bowel sounds. All right. All right, Jason, I'm just going to listen to your abdomen here, okay? Proper auscultation of the abdomen includes listening to 2 to 3 quadrants of the abdomen for any kind of bowel sounds, whether they're hyperactive, hypoactive, or non-existent. Good. Next, you go about 1 inch above the umbilicus, place your stethoscope, and you listen for any kind of bruit. Just relax, Jason, and take slow breaths. And then you go 1 inch lateral on both sides from this point to listen for any kind of renal stenosis bruit. Good. After the auscultation part of the examination, a percussion examination may be done. Using 1 finger, you compare sides. Initially, comparing on the left, Jason, I'm just going to pound on you a little bit here, okay? Percussing on both sides, listening for difference in tone. Next, we start here on the right side. Percussion of the liver span involves first percussing superiorly over the lungs and coming down until a dullness is noted. And then starting inferiorly in the right lower quadrant and percussing up superiorly until a dullness is noted. This helps you evaluate the span of the liver. Next, I'm going to perform a palpation examination of the abdomen. Jason, I'm going to be pressing on your abdomen. If you have any pain, you let me know, okay? It's important that you relax your abdominal muscles when I do this. I'd also like to ask you to bring your knees up if you could. This helps us relax the abdominal muscles when we palpate. Okay. With one hand, extremely important that we also pay attention to the expression on the patient's face when palpating. This is a helpful assessment of pain. All right, Jason. The first thing I'm going to do here is lightly place my hands on your abdomen. And generally, if a patient is complaining of pain, you assess the patient away from the point of pain. For example, if he was having pain in his right upper quadrant, I would start in the left lower quadrant. Superficial palpation involves placing one hand on the abdomen and feeling lightly with the pads of the fingers, and then moving to the other quadrants, feeling for any kind of pulsations, masses, rigidity, and then to the area of pain. Deep palpation of the abdomen involves using 2 hands, also starting away from the point of pain and always observing the patient's face with palpation for any kind of anxiousness or anxiety. Palpation for organomegaly can include deep palpation. For the spleen, we start at the right lower quadrant, palpating deeply, and moving towards the spleen, which is located in the left upper quadrant. A hand can be placed posteriorly to bring the spleen into contact with your other hand. Its tip can sometimes be felt with the pads of your fingers without deep palpation. Palpation of the liver includes coming from the next, Jason, I'm going to palpate your includes the placement of one hand beneath the liver on the right side and the other hand placed in the right lower quadrant with deep palpation approaching the liver as the patient is asked to take a deep breath. Jason, if you could do that. Good. Deep palpation with inspiration can sometimes help you assess the border of the liver. With palpation of the kidneys, it is done in a similar manner. A hand is placed posteriorly over the rib cage, and then one hand is placed in the abdomen and deeply palpated with an inspiratory breath. Jason, if you could just take a big breath. Good. And exhale. Then the other side is assessed in a similar manner. If you could just take another deep breath. Good. The appropriate examination for evaluation of peritoneal irritability is as follows. First, an assessment of abdominal rigidity. Jason, I'm just going to place my hands on your abdomen. All right? Assessment of abdominal rigidity is done lightly. You can feel a rigid abdomen beneath the pads of your fingers, and rigidity should not just be midline, but should be all the way across and laterally. Next, rebound is assessed. Rebound tenderness is done with deep palpation and then release. Jason, I'm going to put my fingers into your abdomen and then I'm going to release. Okay, you let me know if you have pain with the release. Any uncomfortable feeling or pain? And that can be done on both sides or on all quadrants. Next, especially for appendicitis, a McBurney's point can be assessed. The McBurney's point is 1/3 the distance from the anterior superior iliac spine to the umbilicus. It would be in this location. Palpation of this area with pain is suspicious for appendicitis. Next, Murphy's sign is deep palpation of the right upper quadrant in the area of the liver, which is suspicious for cholecystitis. Jason, I'm just going to place my fingers here in your abdomen, and I'm going to push. I want you to take a deep breath and tell me if you have pain with this. Go ahead. Any pain?
No.
This is a negative Murphy's sign. There are two other examinations that are helpful in the evaluation of peritoneal signs related to appendicitis. Jason, I'm going to be moving your hips and knees around a little bit for this evaluation. This is for the obturator and psoas sign. First, I will be performing the obturator sign. Jason, I'm just going to be lifting up your leg here, flexing your hip, flexing your knee, and at the same time I'm going to internally rotate at the hip. Jason, you let me know if you have any discomfort in your abdomen for this, okay? Internal rotation is performed this way. Do you have any discomfort?
No.
Okay. This is a negative obturator sign for peritoneal irritation. The next is called the psoas sign. The psoas muscle is a hip flexor, and with flexion, it could cause some peritoneal irritation, and this is also a sign that is useful for the assessment of appendicitis. All right, Jason, I'm just going to have you bring your foot up and your knee slightly flexed, all right? And I'm going to give some resistance here as he tries to bring his knee to his chest. And with this, you let me know if you have any discomfort or pain, all right?
Okay.
Go ahead and bring your knee up towards your chest. All right, relax. Any discomfort with that?
No.